This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Senior Corporate Communications Officer at the Ministry of Health, Al Alexander.
Good morning, Trinidad and Tobago, and welcome to another Ministry of Health's virtual media conference on the national COVID-19 response. It is a pleasure to be here with you once again. Today, our panel of presenters include Dr. Avery Hines, Technical Director, Epidemiology, Ministry of Health, Dr. Erica Wheeler, PAHO WHO Country Representative to Trinidad and Tobago and the Dutch Caribbean Territories. Thank you for joining us, Dr. Wheeler. And we welcome back Nurse Grace Suchan, Manager Expanded Program on Immunization, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for today. Dr. Avery Hines will begin with the latest clinical update and epidemiological report.
Thank you, Mr. Alexander. Good morning to my colleagues, Dr. Erica Wheeler and Ms. Grace Suchand. Good morning to members of the media and members of the viewing and listening public. The clinical update for the date December 1st, 2020, as at 4 p.m. stands as follows. At that date and time, there were 36,858 unique tests performed, of which 6,685 were positive. And up to that date and time, there had been 120 deaths, and we extend our condolences to members of the bereaved families. At this point, there are 758 active cases in total. Of these, 671 are in home isolation, 29 are in step-down facilities, 42 are in hospitals, and those 42 in hospitals are broken down as follows. There are 25 in the Hoover multi-training facility, one of whom is in ICU, 8 at the Coro Hospital, 2 at St. Anne's, 7 at the Scarborough Regional Hospital at the Fort, and those in step-down and transition facilities that numbered 29 were comprised of 16 at the Claxton Bay Correctional Facility and 13 at UED. And there are 16 new positives that would have been identified over that 24-hour period, of which 7 were from Tobago. There are currently 272 individuals in the state quarantine facilities. Now, at this point, the epidemiological update is going to be very brief. Having given a more comprehensive update on Monday, we would just like to notify the public that our 7-day rolling average is still around the high 20s. It's currently 28. We are looking at that hopefully continuing to trend in the downward direction, and we are taking the opportunity to encourage the population to hold fast to the measures which we have been asking the entire population to adhere to. The physical distancing, the mask wearing, the hand sanitization, most importantly, not going into gatherings when you are ill, not going to work, not going to classes, and the avoidance of the traditional holiday season gatherings as we move into the Christmas season. So I'm going to wrap it up there and turn you back over to Mr. Alexander.
Thank you, Dr. Hines. Ladies and gentlemen, PAHO WHO has provided over 5 decades of quality technical cooperation to Trinidad and Tobago and the region in the field of public health. This support continues even through this current pandemic. I now invite Dr. Wheeler to speak on the Covax facility and the procedures in place for Trinidad and Tobago to access a COVID vaccine when it becomes available.
Good morning, everyone. Good morning, Mr. Alexander, my colleague, Dr. Avery Hines, and to the viewing and listening public. I have a few slides which I would like to share with you in order to update you on the situation with the Covax facility. First of all, let me apologize for the quality of the slides, but I will try to take you through them in a way that you can understand. First of all, the Covax facility is the vaccine arm of something that is called the Access to Treatment, Therapeutics and Vaccines of the World Health Organization, Gavi, which is the Global Alliance for Vaccines, vaccine manufacturers called CEPI, of course, WHO and PAHO. So the Global Covax facility, as you would see from this first slide, even as on the 12th of November, and things are moving fast, there were 212 candidates. Many of them were still in what we call the preclinical phase, but the phase that we are most interested in is phase 3, which is the last phase of clinical trials. And we know now that we have 3 vaccines as a result. This diagram just shows that there are many, many vaccines in the making, and we can expect more in the days to come. Next slide, please. So the access to the COVID-19 vaccines, it is not something that just happened overnight. It's been a global effort. There was a launch all the way back in April between the EU, the president of France, we had Italy, and of course WHO. This was launched. And you can see here the objective of the COVAX facility, as it is called, is tests, treatments, and vaccines. But most of all, equitable access globally. This is really critical because it means that whether you're a low-income country or high-income country or middle-income country, everyone has access to the vaccines at the same time. There is no discrimination. And this is as a result of all these organizations you see here. CEPI, as I said, the vaccine manufacturers, Gavi, Unit Aid, which deals with vaccines at the global level, even the Global Fund, the World Bank is supporting it, and the Bill and Melinda Gates Foundation. Next slide. So just to give you an overview, because it's really important to understand what's going on in the world. If I show, this diagram shows that the other arms, apart from the vaccines, which you would see on the bottom right of your screen, which says Equitable Allocation Framework, COVAX Allocation Mechanism Established, you would see that there is another arm which deals with testing. And we know, for example, now even in Trinidad and Tobago, we have rapid diagnostic tests. They were acquired through PAHO at a reduced price. We also have life-saving therapies. You would see there dexamethasone. Initially, we heard a lot about hydroxychloroquine, which was dropped because it was shown not to be effective. There was remdesivir, which also is on hold, all the trials, because it has not proven to have any ameliorative effect on morbidity or mortality. But you would see something called monoclonal antibodies, which are under evaluation. And these are one of the treatments that even the President of the United States of America received. So we have different arms. And the COVAX facility, as you would see on the bottom left of your screen, there are now 187 countries in the world that has joined this facility, which means that each of these countries, they have put down funding in order to accelerate the speed at which vaccines have been produced. And this is why, in such a short period of time, the world has been able to see even now 3 vaccines that are going through a stage of emergency use in the world today. It is thanks to the COVAX facility and the fact that it was funded upfront so that the vaccine manufacturers could very speedily produce vaccines. They did not have to wait, as in the past, to do the research, produce a vaccine, and then compete with others to get it onto the market. So this is the first time this has ever been done. Can I have the next slide? So the next slide shows you that even in our part of the world, we have actively contributed to the allocation mechanisms for the vaccines because Trinidad and Tobago has paid down. We are part of the Covax facility, and that is really important, which means we have access to the vaccines globally. We know also that each country is going to get initially 20% of the 2 billion doses that are expected to be produced by each vaccine manufacturer by the end of 2021. So we receive doses proportionally to the total population of the country. And then as time goes on, other categories of persons will receive the vaccines. Next. Again, apologies, this is not very clear, but the idea is that this Covax facility, or the whole ACT accelerators, it's called, as I mentioned, therapeutics, tests, and vaccines, has engaged people at all levels, the partners that I spoke about, but also it goes much further. It is broken down so that we know what are the work plans and the plans of each country that's going to be receiving these vaccines. So every country has to show that they're in a state of readiness in order to access the vaccines. Next slide, please. So the objectives here, let me reiterate, is to end the acute phase of the pandemic by the end of 2021. This is the objective of the COVAX facility. To deliver 2 billion doses by the end of 2021, and it seems like we will be well on the way there, seeing that we have 3 vaccines already that are being approved for emergency use, but we know more will be coming in January. To support the largest actively managed portfolio of vaccine candidates globally, to guarantee fair and equitable access to COVID-19 vaccines for all participants in all 187 countries, and to offer a compelling return on investment for the vaccine manufacturers as quickly as possible. Next. So we see here on this slide that the Gavi, which is the Global Alliance for Vaccines, they are also providing vaccines free or at very, very little cost to countries that cannot afford to even pay down the initial amount, such as countries considered high-income countries like Trinidad and Tobago. But in the Caribbean, we have 10 such countries. So it shows you here that the COVAX facility through Gavi even supports those 10 countries in our region. But we are a high-income country, and we have already contributed to the payment of vaccines. I believe that's my last slide. So what I want to say in total is that Trinidad and Tobago is a member of the COVAX facility. Trinidad and Tobago has also begun to prepare to receive the vaccines. We will be receiving initially a total of 280,000 vaccines. The priority groups have already been identified by the Ministry of Health. A project lead has been established. There will be a multidisciplinary group, which is mandatory going forward. There's already a communications plan that's being thought through, and with IT support, financing, and monitoring and evaluation. So this is what the COVAX facility is about. This is where we are in terms of Trinidad and Tobago holding its role in the region, contributing, and we will be recipients of not just one vaccine, but possibly a mixture of different vaccines that would suit the population of Trinidad and Tobago. Thank you.
Thank you very much, Dr. Wheeler. I now invite Nurse Sukchan to update you on the preparations being made by the Ministry of Health to receive, store, and distribute the COVID-19 vaccines when they arrive.
Thank you, Al. Good morning to Dr. Hines and Dr. Wheeler, and it's a pleasure to be here again, once again, with your viewing and listening audience. So can we go to the first slide, please? Right, so this is just a brief update on the Ministry of Health preparation for COVID-19 vaccines. And start by saying that much remains unknown about the full characteristics of the COVID-19 vaccines that will receive authorization and therefore which vaccine products will be available to countries. We know from news being released that Pfizer would be offering their vaccines to the population. 200 candidate vaccines are at some stage of clinical development. As Dr. Wheeler would have informed you, we may be recipients of more than one vaccine. The first phase 3 trials began in July of 2020, and the results for these few candidates would be expected at the end of this year. The earliest use authorization of COVID vaccines is also expected at the end of 2020, and as you all can see, we are getting there. Next slide, please. It is anticipated that most of the COVID-19 vaccines will require at least 2 doses for optimal immunogenicity. Storage and distribution temperature would likely be +2 to +8 degrees for most of the vaccines. And of course, some may require an ultra-low cold chain of -20 to -80 degrees storage. The COVID-19 vaccine products are likely to have varying vaccine characteristics and presentation. Next slide, please. The COVID-19 Vaccine Global Access, or Covax facility, was established to accelerate equitable access to appropriate, safe, and efficacious vaccines. Trinidad and Tobago has signed on to the Covax facility in September of this year, and it is a mechanism through which demand and resources are pooled to support availability of equitable access to COVID-19 vaccines for all countries. The facility will serve as an invaluable insurance policy to ensure access to safe and effective vaccines through its actively managed portfolio of vaccine candidates across a broad spectrum. The facility will negotiate best possible pricing from manufacturers, and this will be passed on to the participants. Next slide, please. So the Ministry of Health, in preparation, has established a national coordinating committee. This committee would be responsible for planning, coordinating, and implementation of activities, review global level information from WHO and UNICEF related to COVID-19 vaccines, and incorporate it into the planning and preparation as needed. Elaborate the deployment plans with clear functions, responsibilities, and deadlines. Establish an operations room for coordination, information, and communication. Take final responsibilities for implementation activities. Report to higher level authorities when needed, and communicate with partners and the press. Next slide, please. So vaccines currently being developed vary in storage temperature, and as I said before, ranging from -2 to 8 degrees Celsius to -80 degrees Celsius. And the Ministry of Health has established a project management team to ensure readiness for the vaccines. Next slide, please. Right. So, for TNT to achieve timely and successful introduction of the COVID-19 vaccines, the Ministry of Health will engage in multi-sectoral collaboration with key stakeholders. The main roles and responsibilities of this group are basically to provide technical support, resource identification, and mobilization that is essential for program implementation, to participate in the planning, follow-up, management, monitoring, and evaluation of mechanism of the immunization program, and to provide recommendations on improvement strategies. Now, in order to do this, the National Technical Advisory Group will provide evidence-based recommendation and policy guidance specifically related to COVID-19. And our National Technical Advisory Group is a multidisciplinary group of national experts from Trinidad and Tobago who is responsible for providing independent, evidence-informed advice to policymakers and program managers on policies, issues related to immunizations and vaccines. NITAG, therefore, may decide to set up a committee specifically with respect to the COVID-19 vaccines. Next slide, please. So, with respect to vaccines technologies, what are the aims of a vaccine? Basically, vaccines aim to expose the body to an antigen that will not cause disease, but will provoke an immune response that can block or kill the virus if a person becomes infected. There are at least 6 vaccine technologies being tried against the coronavirus, and they rely on weakened or inactivated virus or viral particles. Next slide, please. And this slide basically, it's a bit small, but basically tells us about the type of vaccines. So you have the inactivated virus vaccines, and if you look carefully with respect to description, the pros and cons, and examples, you will see that we do have vaccines that fall under some of these listed here, the types of vaccines. Under the inactivated virus vaccines, we have the rabies, we have influenza, you have your life attenuated. Apart from measles, you also have polio, yellow fever. Under viral vector vaccines, this is pretty new, and none has really been pre-qualified as yet, but as you all know, both Pfizer and Moderna fall under that category to be reviewed and basically to get authorization for use. Then we have the nucleic acid vaccines. Oh, sorry, my mistake. Let me go back to viral vector vaccines. So, under the viral vector, we see that we have this one basically does with prior exposure to viral vector, which reduces immunogenicity. And under the example, we had the Ebola. We have not had that vaccine in Trinidad and Tobago because, of course, within the Caribbean, we have not had this disease condition. So, under nucleic acid, we talk about the RNA and DNA vaccines. And under this, Pfizer and Moderna would fall under the RNA vaccines. With respect to virus-like vaccines, we have the HPV. And protein subunit vaccines, we have hepatitis B. Next slide, please. And so if you look at the slide now on screen, you will see the different platforms that are being used with respect to COVID-19 vaccines candidates. You have the nucleic acid, and under this you have Moderna, Biotech, Pfizer. You have viral vector, the AstraZeneca falls under that, as well as others listed there. And then you have the protein subunit. Basically, most of these vaccines are going through their final phase and still to be approved by WHO and the regulatory bodies for use. Next slide, please. And in conclusion, basically what I want to say, and for the population, the message we want the population to take is that the benefits of vaccination extend beyond prevention of specific diseases in individuals. Vaccination makes good economic sense and meets the need to care for the weakest members of societies. The Ministry of Health is working towards ensuring national capability and capacity for the COVID-19 vaccine, because the protection of the population from vaccine-preventable diseases like COVID-19 is of high importance. And back to you, Al.
Thank you, Ms. Sukhchand. We now move to the question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask your questions one right after the other to the relevant members of the panel. If time permits, we will accommodate a second round of questions, this time 1 question per media house. Today we begin the question and answer with TTT. Good morning, TTT.
Yes, hi, good morning. Good morning to the panel. Sonal Lala from TTT News. To Minister Hines, we received some a media release from the Trinidad and Tobago Defense Force with regards to the illegal immigrants who arrived at the heliport on, I believe it was Sunday. They stated that 1 person tested positive for COVID-19. Can you give us any updates on this? regarding that?
Okay, minor but important correction. I'm definitely not a minister. So thanks for the promotion, but I think I'll decline. Now, the media release that you received is the same that we have. There is no additional detail that we can provide beyond what has been stated in said release. If you like, we can read the release out to you, but it does indicate that there was an identified case and that, in summary, all the necessary protocols had been observed in treating with same. I'm just going to run through it very quickly for the benefit of those who may not have seen or heard the release. And this is as at December 1st, 2020. Just a moment. Stating that the Defense Force wishes to advise that that on Sunday 29th November, Venezuelan immigrants who arrived were tested. Those results of the test indicated that one person was tested positive. They were separated from other detainees at the infirmary department, and that all the protocols involving those who were in primary contact had been followed, and that they will be followed over the relevant time frames for quarantine and follow-up. And during this period, physical visits from outside persons concerned to the heliport will be restricted, in summary. So not reading through word for word. But that's as much information as we have and are able to share at this point in time.
Thank you, Dr. Hines. We now go to 98.1.
And very good morning to you, Mr. Alexander, and the panel, Stephen Cummings, 98.1 FM. And we just have two questions, one for Dr. Wheeler, and the other, any member of the panel can take the other one. Dr. Wheeler, in the past 72 hours, we have been hearing of approvals of Pfizer for use, at least in the UK. Do we in Trinidad and Tobago have a fast-track facility available to us within the Covax program? There's a race to the finish line, and countries are in great demand. And the other question is, Dr. Hines, maybe you can address this as well, if you can. Is there an alternative method of vaccination for COVID-19 away from the literal use of the needle, for example, oral dosage?
Okay. Good morning. Thank you very much for your question, Mr. Cummings. So the situation with the UK is somewhat different from us. First of all, you may or may not know that countries like the UK, they are both part of the Covax facility, which means just as the rest of the world, they can receive vaccines, as well as they have bilateral agreements with the vaccine manufacturers because they're a developed country and they have the funding. We don't have any bilateral arrangements. In addition to which, at this point in time, the country needs to be in a state of readiness to receive such a vaccine because, as Nurse Sukchan said, you would see that there is a need to have store the vaccine at extremely low temperatures. So there has to be a certain state of readiness to receive the vaccine, and there are different measures that have to be taken. Nurse Sukchan also mentioned that there will be a task force set up that will be governing these things. So right now there are negotiations going on between PAHO and Pfizer-BioNTech, because another piece of information is that this vaccine is much, much more expensive compared to the other two vaccines, some of which they've applied for emergency use at this point in time. So PAHO is negotiating to have the best possible prices for vaccines, as well as the country needs to be in a state of readiness to receive a vaccine, especially one which must be stored at extremely low temperatures. So right now we are negotiating to include the Pfizer-BioNTech in the Covax facility to get it at a reduced price. And when Trinidad and Tobago has the facility, that is a choice that the government would make based on also global advice about suitability for the vaccine. But certainly Trinidad and Tobago, once we are ready, will be able to receive it and at a price which is affordable, because the government has already made a down payment and will pay for the vaccines coming in, but we must make sure that the country is in a state of readiness to receive the vaccines. Thank you.
Okay, thank you for your question regarding other means of inoculation. Each vaccine will come with its particular recommendations, each type of vaccine, regarding the best route for inoculation. So the choices will vary between whether it's an inhaled or an oral or an injectable, and it really depends on how best the immune system can be stimulated to generate a response. At this point in time, as far as I'm aware, and Dr. Wheeler can correct me if I'm wrong, the vaccines that are currently under consideration are all injectable, but there are the options in other types of vaccines for nasal inoculation or sometimes oral droplets, as you may see in the polio vaccination. So right now, I believe the only vaccines for COVID-19 in particular are injectable. As others become available, that information will again be shared.
Thank you, Dr. Hines. We now move to Wired 868.
Hi, good morning, everyone. This is Fayola Bostic, Wired 868. My first question is for Ms. Sukchan. When the minister spoke to us, I think a few weeks ago, he mentioned that we would need to build, I think, walk-in freezer storage as well as to order ultra-low temperature freezers. Can you give us an idea of where we are in terms of have those freezers, walk-in freezers, been built, or what's the timeline for receiving the freezers so that we will be in a state of readiness to receive the vaccine? That's my first question. And my second question is to Dr. Wheeler. You mentioned that the Covax facility it would be guaranteeing equitable access. I was wondering if you could just speak a little bit more about what are the describe the measures in place to actually achieve that, especially after the phase, because as we saw at the beginning of the pandemic, when it came to PPE, ventilators, these kind of things, lower income countries were complaining that either PPE was stopped from coming to them from richer countries, or the richer countries were buying them up, causing a shortage. So what are some of the measures in place to actually ensure the equitable access, especially after the first phase, when the 20% of the population would be vaccinated?
Ms. Sukchan, you want to take the first question,
yes,
please?
Yes, thank you. So yes, the Ministry of Health, as I mentioned, has identified 3 sites to store the vaccines. One at Cuba, one at Chaguaramas, and one would be in Tobago. With respect to the installation of the chillers, that will fall under the purview of the project management unit that the ministry has engaged in, and they would probably have the timeline. At this time, I would not be able to give you the information with respect to the timeline as to when those chillers would be ready, but I do know that they are working on it. I can also say that currently, Minister is doing a walkthrough at Chaguaramas Central Stores to look at the facility available there for the other sites in terms of storing the COVID vaccines. Alan?
Thank you. Dr. Wheeler?
Yes, thank you very much, Ms. Bostig, for that question, a really important question. So, as I mentioned during the presentation, this is an unprecedented collaboration between the different organizations, the vaccine manufacturers, WHO, the Global Alliance for Vaccines in the main, to come together to create this facility to ensure the equitable access. And what does that mean? Up front, all the way back from April and May, several $1 billion were raised globally through the European Union, Italy, France, and so on. So the vaccine manufacturers were actually funded up front to produce these vaccines. And there was a global agreement made by these parties in order to ensure that once vaccines are produced, that there is no discrimination between low, middle, and high income countries. So it is governed by legal rules, but also by the fact that Gavi, that normally distributes the vaccines, are working hand in hand for the first time in the history of vaccine production to ensure that the amounts of vaccines released, yes, I know you said after the first 20%, would be available to population. So part of the agreement is that after the priority groups are identified, that countries will be able to acquire additional doses as part of Covax. That's why it was so important for us to be part of the Covax facility. So rather than taking chances and saying, oh, I will have a separate bilateral agreement, being part of Covax, it is binding. So it means that you will acquire those vaccines as part of that agreement. So this is something that has been long under negotiation. The fact that the facility is in place, it is supported by both technical, administrative, and legal rules, and the vaccine manufacturers have all signed up for it. All of those who are part of the Covax facility have signed up. So therefore, there is no question that one country that is rich can go ahead and get 3/4 of the vaccines. No, there's a global agreement, and there will be controls over how the vaccines have been distributed. But as I also mentioned, countries also have to be ready to receive the vaccine. So there are very strict rules that would be monitored about what percentage of vaccines are distributed globally to make sure that there is equity amongst all of the 187 countries who are part of the Covax facility. Thank you.
Thank you very much, Dr. Wheeler. AZP News, we are ready for your questions.
Hi, good morning. Priya Bihari, azpnews.com. My first question is for Dr. Wheeler. Dr. Wheeler, in your initial presentation, you said that we would be able to get a vaccine that suits the population of Trinidad and Tobago. Can you tell us what that means? Is it that certain vaccines may not be good for us? Can you let us know what you mean by that? And is there an idea when Trinidad would be able to get its first vaccine at this point in time? Thank you.
Thank you. Thank you very much, Mr. Bihari. So when I mention suitability, there are some considerations to be made. Some vaccines may be more suitable for older populations compared to younger populations. We always knew this from the beginning. Because of the different methods of producing it, the persons on whom the vaccines were tested. I know when you reach clinical 3 trials, you're talking about 30 or 40,000 vaccines. Some of them, they have been tested on persons in different parts of the world, but they are more efficacious, meaning that they do eliminate the disease. That's what, when we talk about the efficacious vaccine means, it is able to eliminate the disease in individuals. Some of them, they work better with older rather than younger people. So each vaccine has to be, we have to agree as a country, for example, that we may take 2 or 3 vaccines because some are more suitable for some age groups compared to others. So it doesn't mean that there's anything wrong with the vaccines, but remember, Sukchan showed the 6 different ways that the vaccines are being produced. The data has to be examined to see how persons in those different age groups respond to the vaccines. This is part of the clinical trials and why it is important that even WHO examines all of the data from the manufacturers in order to certify the vaccines, because we are not going to get any vaccines that are not pre-qualified. So that's what I meant by suitability, and that's what the manufacturers themselves mean by suitability, that it addresses the disease, but some may be more efficacious in some age groups more than others. And as to when we may get the vaccine, this is a combination of 2 things. cost of the vaccine. As I've already mentioned, the Pfizer BioNTech vaccine is actually the most expensive of all three, and we have already paid down as a country to receive vaccines at a pre-agreed price. So now PAHO is negotiating to see if we can bring down the cost of the vaccines to Latin America and the Caribbean region. So it's a combination of that price plus the readiness that Sukchan was speaking about. You know, there was the question before on where Trinidad and Tobago is at with storage facilities and so on. So both things have to come together and they have to be monitored, because the last thing you want is to receive a vaccine and you can't store it and the vaccine becomes ineffective because it's been stored at the wrong temperature, or it's more suitable also even for distribution from a point like a hospital rather than a clinic. And it's not so mobile that if you have arrangements to take the vaccine, say via mobile clinic to other parts of the country, some vaccines may be able to be stored for longer periods of time compared to others. So we have to take all of these things into consideration. That's why there must be a task force set up where all these decisions are made and looked at in detail. Thank you.
Thank you very much, Dr. Wheeler. We now go to Tobago Channel 5. Tobago.
Hello, good morning. Candice Jackson, Tobago Channel 5 News. I just want a little bit more clarity on what you said, Dr. Wheeler, in regards to the vaccine. You said, of course, some vaccines might be suitable to various persons based on age and so on. Based on the vaccines that we have close to being ready, I guess, is it like that Pfizer is, I guess, more ready, is better suited for older persons, Moderna and that sort of thing? What are you guys seeing so far? As well as, okay, I will just go with that question for now, sorry.
Okay, well, so far what they've been looking at more than anything else is not only the age groups. I'm just checking here on my notes too, but the safety of the vaccine as well, which I didn't mention. I mean, when you talk about vaccines, you have to talk about the efficacy, you have to talk about safety, you have to talk about quality. So they're looking also at safety. So just to give you an example, in the Pfizer BioNTech vaccine, they were looking at two types of the vaccine, and one was shown to be more safe compared to the other because and had less side effects in younger persons compared to older persons, for example. So the second type of vaccine, there was not as much swelling and redness, and there was not as much of people not feeling well. So you have to look at the suitability in terms of the age, but also, you know, the reactions, the safety, how they're received by persons. So far, there is not any specific bias in terms of age group, but what we did see for the Pfizer-BioNTech vaccines, the type 2, that is the one that's being produced, that it shows like less swelling, less redness, and less, not feeling well after you receive the vaccine. So there are different aspects to ordering a vaccine, because you don't want to have a vaccine that maybe causes older people to be not feeling as well. So in the Pfizer-BioNTech one, younger groups, it seems like younger people react less. They have less side effects, so to speak, to the vaccine. But as far as we can tell, because please remember, there has been no publication of the data as yet. Everything has happened very quickly. We are getting press releases and we're getting some limited information, but we don't have published peer-reviewed data, because that will come in the course of time, and that will be part of the whole pre-qualification process by WHO. We have some limited data and we have the results in PAHO of what they say about these vaccines. But so far, they seem to be applicable to the different age groups, but maybe with some biases in the Pfizer-BioNTech, maybe younger people react less in terms of side effects. But none of them have shown to be not effective or not safe. And that's important, because by the time you reach clinical 3 trials, you can't pass a clinical 3 trial unless you are shown to be that is both efficacious, that it's safe, that the quality is good. And it will never be pre-qualified by WHO if it does not tick all of the boxes. And I am just saying it very, very briefly, but it is quite a rigorous process. So we can have all of the 3 vaccines so far that have been produced, but I go back to my previous comments about the readiness of the vaccine and the decision based on cost, and what the government then decides whether they would like to get some of all 3 or 2, or, that's a decision that would have to be made when the government is ready to receive one or other of the 3 vaccines that are on the market now. But all 3 of them are suitable for Trinidad and Tobago population. Thank you.
Thank you very much, Dr. Wheeler. We now go to TV6.
Hi, good morning. Alicia Boucher from TV6 News. Are you all hearing me?
Yes, we are. Please ask your questions.
Hello?
Please pose your questions.
Can you hear me?
Yes, please go ahead, pose your questions.
Okay, Alicia Boucher from TV6. Good morning. My first question, Dr. Wheeler, you would have mentioned, that none of the vaccines that are being looked at for approval are unsafe and ineffective. But my question has to do with any possible long-term effects, given that, there has been a race to find a vaccine. COVID-19 would have broken out in China in November, I believe it was, of last year. What about possible long-term effects that we may have, but we haven't had the time to see what that might be, given the race to find a vaccine? That's the first question. The second question, I think you said Covax facility they're going to distribute 21 million vaccines by 2021. I may have that figure incorrect, but if it is 21 million vaccines, it's 100 plus countries. It seems a bit meager, especially given that the UK has ordered something like 40 million vaccines, which would be able to vaccinate 20 million people, especially after that first equitable tranche is distributed, that 20% is distributed evenly. Do we have any fear that, we may not be able to access vaccines like we would want to?
Okay, thank you very much, Ms. Boucher, for your question. Actually, it's 2 billion. It's 2 billion doses, and we have 3 vaccine manufacturers now, and I believe even AstraZeneca was saying that they would like to produce 3 billion doses by the end of next year, and their price that they have given is only £3, or probably somewhere around $5 compared to the BioNTech, the Pfizer-BioNTech vaccine, which is much, much more expensive than that. And then you have to add the cost of transport and so on. So that should allay your fears about the quantities, that it's actually, the aim initially was 2 billion. And we have 3 sets of vaccine manufacturers now that are producing vaccines. So I think that is very doable. In terms of the long-term effects, I am glad you asked this question, because this is a universal question. Everybody is worried about long-term effects, and that business of it's produced so quickly. So how are we sure that there won't be long-term effects? Now, I think what is different from this, and we have to go back to the Covax facilities, that normally, yes, it takes a very long time to produce vaccines the traditional way, but the Pfizer-BioNTech vaccine, for example, it's a novel way of producing vaccines, but it does not mean that it is not a safe way. We have to remember what is different and unique about the Covax facility is that it was funded up front. So it's like, if you're going to build your house, before you, let's compare it to someone who is saving money every month to put towards the building of their house, because if you have a country where half of the people can't afford to get loans from the bank, they save their money every month and they put towards building their house. So it may take them 5 years. This way, with the Covax facility, it's like somebody saying, we give you a mortgage for 100% upfront, and you can just go and buy everything you want. And you can, if you have to make the bricks yourself, we include the money for making the bricks, and you can build your house. And therefore, instead of waiting 5 years to build your house, you can build your house in 1 year. So the COVAX facility, the pre-financing of it, and of course the excitement of the competition, I'm sure, between the vaccine manufacturers, because all of them wanted to be the first in the world to produce the efficacious and safe quality vaccine for the population. Imagine the kind of the consequences of that as a vaccine manufacturer for the future. So it is the combination of that, the fact that it was pre-financed and that there were new ways also of producing the vaccine. Amongst the 6 ways, you would see the Pfizer-BioNTech one was out front because of the way it was produced. So, this was an unprecedented effort. And of course, it is impossible to know. We would not have known when we got the measles vaccine the very first time, or tetanus, or anything else when it was produced for the very first time. And they would have gone through the 3 phases of clinical trials as well, because otherwise they would not be pre-qualified. But we would not have known into the future what would be the long-term effects. In addition, let me also bring to mind the flu vaccine. Every single year, the flu vaccine that you receive is not exactly the same as the flu vaccine you received the year before, because every year they study the virus, because it changes just a little bit, a little mutation. So then there is a little adjustment made to the vaccine. This might very well be the same thing. Remember, we are at the beginning of this, and as time goes along, look, right now, for example, the 3 vaccines, as Dr. Hines correctly said, they are injectables. The 3 ones we have, they're 2-dose vaccines. There are also 1-dose vaccines on the market that may come out next year. So, nothing is fixed in stone. The most important things are the fact that they prevent the disease and that they're safe, and that the quality is good. All of those things, they're suitable. Those are the things that have traditionally been looked at by WHO. WHO is not changing its standards just for COVID-19. They have standards. They have their clinicians, their physicists, their everybody, their engineers from all over the world, the teams that work with WHO, that would look at all of the different areas of pre-qualification. That is not going to change. So, and the fact that they have to go, the vaccine has to go through the clinical trials. They have to show the evidence of, the safety and so on. So we don't have a crystal ball. We may actually get better at producing it. We don't know, for example, how long we will have immunity for, but those things take time. And the race to end the acute phase, which is why we have the COVAX facility. Look at the number of people in the world who have been infected. Look at the number of people who have died. So the objective was to set up the COVAX facility so we can end the acute phase of the pandemic. And this is why I myself, I am not worried. Once WHO PAHO pre-qualifies it, I will have my vaccine, because we don't know the long-term effects, but just remember this: WHO will not pre-qualify any vaccine that does not meet all of the traditional requirements of being efficacious, being safe, being suitable, and of good quality. Thank you.
Thank you very much, Dr. Wheeler. We received a WhatsApp, some questions via WhatsApp from the Newsday, and I'll read them. Does the approval of Pfizer vaccine by the UK for usage influence our decision as to which vaccine is most effective for use in Trinidad and Tobago? And a second question, have recent influxes of illegal migrants into Trinidad and Tobago put any strain on resources dedicated to addressing COVID-19?
Okay, thank you. I'll take the second question first, and then I'll split the answer to the first question between myself and Dr. Wheeler. So the short answer to the second question is no, there haven't been any strains put on the resources or the systems in place for dealing with COVID-19 as a result of the influx of any of the migrant issues that have arisen in the past few days. With regard to the first question, the decision is not going to be influenced by what happened in the UK, but the availability of the vaccine itself via the existing Covax facility, and the negotiations currently ongoing will determine what happens with regard to that additional available vaccine, and I can allow Dr. Wheeler to perhaps expand on that a bit.
Thank you, Dr. Hines. Yes, on the 10th of December, there will be a meeting of the PAHO Directing Council with our member states. We are asking member states about their appetite for the Pfizer-BioNTech vaccines, meaning, do they want a lot of it? Do they want a small quantity of it? Or do they want none at all? We don't make those decisions for member states. We ask them and then we facilitate it, because it's between UNICEF and PAHO for this region that we are discussing the supply of vaccines according to what member states want. So we will take advice from our member states. So if member states say they want a lot of the vaccines, we will negotiate the price accordingly. If they say they want a small quantity of the Pfizer-BioNTech vaccine, we will do so accordingly. Or if some countries say no, they don't want it, and other countries say yes, it will be the prerogative of the countries. But I agree completely with what Dr. Hines says. It should not influence whether we receive the vaccines or not, because they're all tested on, on persons from different parts of the world. So that does not come to bear. It is really up to the member states to decide what they want, what quantities of which vaccines that they want, and they will be procured via PAHO. Thank you.
Ladies and gentlemen, I would like to thank the media representatives. We have come to the end of today's media conference. We ask that you please protect yourself and your loved ones this Christmas. If you haven't received your flu vaccination as yet, please get yours now. Contact your nearest health center for details. Remember, get the vaccine, not the flu. Also, please adhere to the simple COVID-19 health guidelines. Wash or sanitize your hands and clean frequently touched surfaces. Maintain at least 6 feet physical distance from others. Wear a mask in public and stay home if you are ill. Remember, COVID-19 is not a gift you would want to give or receive from anyone this Christmas. Goodbye for now.
Where you hustling now up to? This is the beach. You're supposed to be relaxing.
Well, I'm going to get some bacon shark.
Oh, all right.
Yeah, me and my boy, yeah.
Just remember, it's still have COVID out there. Beach or no beach. Yeah. Hey, you wash your hands?